Wow. Wow, right? Here we are in 2025. It surprises so many people to know that intimate partner violence is still an issue today, affecting over 1 in 3 women with health and economic and housing impact. We've learned since the Violence Against Women Act, we can't criminalize our way out of this. We really need the tools of public health. And it's incredible to see you really deliver this holy grail, which is creating an option for people that are at risk of perpetrating harm. And the video was amazing. I know it was so much harder than that. Tell us about some of the challenges in this work.
Thank you so much, Michelle. The hotline is one of several innovative approaches to addressing harm against women in intimate relationships that's taking place at House of Ruth, Maryland. And in developing the Gateway to Change hotline, we conducted a formative evaluation, which consisted of engaging a range of stakeholders through qualitative and quantitative research, developing a robust staff training protocol, and of course, making sure that we had evaluation and monitoring metrics in place. And we are thrilled since the implementation in April to have had a steady rate of calls. We received a call from a partner who had recently strangled their intimate partner, which in intimate partner violence research, we know is an indicator of intimate partner homicide. This person found the hotline number through ChatGPT and reached out to the hotline at House of Ruth, Maryland. Some of our lessons learned in this work is that confidentiality begets trust. We had done our formative work and we knew that the hotline was mostly welcomed by staff, by survivors, by potential callers, and we were also amazed at the level of candor that we have received among the callers. We also recognize that meeting people where they are, taking a stage-based approach to violence perpetration work has been a missing aspect of our work in this space, and it has been beneficial in this regard. And also, as we know, in any public health approach, proper infrastructure. So I mentioned the staff training, the protocol, all of these pieces. We want people to know that you can't or you shouldn't implement a hotline like this overnight. There are pieces that have to be in place. And so we developed a readiness protocol, which is available on the website provided by the Bloomberg American Health Initiative. We invite folks to check that out. And we look forward to scaling up this effort. So next steps include an outcomes evaluation, assessing or evaluating the impact of the hotline among callers. Also increasing visibility, our marketing strategies, engaging additional community partners. One of the strengths of this hotline is that there is a strong referral pipeline. So when callers call in, they are referred out to supportive services that may help reduce their use of violence. And then technical assistance. We are available to organizations who might be interested in developing a hotline like this. So as we all know, engaging people at risk of causing harm to an intimate partner is really is one component. It's addressing the root of violence, and there is so much more work to be done to address violence against women, which is why I am deeply grateful for the work that you all do and are leading. Tiara, I know that you are doing amazing work in the sexual and reproductive health space regarding intimate partner violence. Do you mind sharing with us a little bit about your work?
Yeah, I'm happy to. I mean, we've seen a lot of promising results so far. We've been working with healthcare providers, clinical staff, even on the front line, in order to kind of respond to intimate partner violence among patients. We've seen those promising results that even though there was a little bit of a hesitation in the beginning from staff on how to actually implement these protocols, we've seen self-efficacy, their confidence to do these protocols increase over time. We've seen a lot of trust be built between patients and providers as well, which we know is critical for disclosing and intervening on partner violence. And so we're really excited that work has really been blossoming in Baltimore, and we're looking forward to seeing its impact just kind of grow, because we know that the healthcare sector can really be a solution for partner violence. And it's another reason why policy investment is really needed in order to kind of scale up this type of intervention. And I'll pass it to Michele, who'll talk more about the policy landscape.
Oh, we are at such an important and exciting moment, I think, in this space, right? So, building these threads, we know that there's no one single solution. We've got to layer in prevention. We've got to layer in access to support services through the healthcare sector and beyond, scaling up our direct service providers and making sure that workforce is really ready and robust to handle the volume of all of this. And just in the past few years, the field has really coalesced around these multi-pronged priorities, generated that first national plan to strategize thoroughly across all of these aspects. And I think we're about to see just incredible movement from states and cities to really bring this into reality. Super.
I agree.
Yeah, over to you. So watch this space. It is so incredible to see this solution lens and the incredible work that you've been done. So thank you.